everyone, Dr. Ellie here with my podcast, I Heal Kids. Again, I'm excited to bring you some really cool information today on natural cold remedies that every parent really needs to know so they can soothe their sicko kids, and also how to prevent. If you don't know me, I am Dr. Ellie. My practice is Middle Path Integrative Pediatrics, and my practice is in Asheville, North Carolina. So if you are in or around Asheville, North Carolina, and you need a holistic pediatrician for kiddos 0 to 21, please reach out. Also, if you need a functional medicine consult to increase longevity, vitality, for pre-fertility issues, for gut issues, for brain health issues, a whole list of issues that you can find on my website, ages 2 to 102, I am happy to see you for that as well. All right, natural remedies. Let's get into this. I think this is like so exciting. I really love echinacea. I really love elderberry. They're great for immune support. Elderberry in particular is really nice if you have a cold from influenza virus. It helps block the hemagglutinin A molecule, which is like this little part where the virus can get into the cells. And so elderberry is really helpful for that. There's great syrups out there. Gaia makes a great syrup. There's gummies by Gaia. They're pretty easy to find. We have them on the Full Script store if you need them. So, either take them throughout the season or while your kiddo is sick, and that can be really helpful. Ginger and garlic, also super anti-inflammatory and antiviral. If you're not already incorporating it into your food in general, this is a great time if you are ill with a cold just to go ahead and do that. Lots of soups have ginger. Turmeric is another one that's anti-inflammatory. Add some of that in. Garlic. I really love making like this really fun cabbage soup out of the Oh She Glows book, and we can add that in the show notes as well. And reishi mushrooms. So a lot of people don't think about mushrooms, but they're very, very helpful for the immune system. So if you make like a lovely mushroom soup or stew while you're ill, those things can be really helpful in supporting your immune system. So zinc. Okay, so this is a little bit of a complicated topic. Essentially where the research stands now is it could be helpful. We're kind of saying it could be helpful if you start it within the first 24 hours. You're doing like a lozenge or something like that. I think they make these little things that go up the nose, but usually kids won't do those. So generally it's lozenges, which by the way, you don't want to do a lozenge for a kiddo under 6 because that can be dangerous because of choking hazard. If you are using it, kids over 6 in the first 24 hours, and keep in mind, you don't want to go overboard with zinc because that can actually cause a situation where you're displacing copper from the body, and that can be a little bit dangerous. So a lot of times for kids, like especially under 6, go ahead and just offer them zinc-rich foods. And you may not think it, but like blended oysters have a lot of zinc. So if you can blend up a little bit of oyster meat in with like some other meat they're eating, like hamburger or something like that, that can really boost their immune system. So definitely add those zinc-rich foods in. Propolis, also amazing for the immune system. So if you need to get something with a little propolis product. Honey. Okay, I get questions all the time about like cough syrups, and this is one where I recommend honey 99% of the time. The cough syrups on the market, first of all, they're full of, well, maybe not Zarbee's, but there's a lot that are full with a lot of junk and preservatives and food dyes and colorings and all of this. And do they really help? Not really. Sorry to be the bearer of bad news. I don't think I've ever really had someone tell me that they got a cough syrup for their child and it was like the miracle drug and they were so happy they bought it. Usually it's the opposite. The only time I may hear something like that is if it's a cough syrup that has something that helped their kids sleep, like an antihistamine, which helps them sleep, like Benadryl, which, there's other things with that we need to talk about. But in general, for cough syrups, I wouldn't spend your money. So we need to figure out what the cough is from. But if your child's cough is from a cold, which in this case, that's what we're talking about, then most likely the cough is because they're having postnasal drip. So the mucus in their nose is running down the back of their throat. And what is happening? They're kind of choking on that and coughing things up. So we want to coat the throat. And truly, one of the best things for this is just teaspoons of honey throughout the day. So I do highly, highly recommend just using something simple that you already most likely have at home. Be careful, kids under 12 months. We don't want to give honey because of the Clostridium botulism spore that isn't present in honey, and their immune system can't really fight it off very well. So not for kids under 12 months old. Hyssop flower, really, really amazing antiviral. If you have things like, I think there's some tinctures and different glycerites out there by like Herb Farm, and there's a few others that we can put on Full Script for you guys. boys that have some hyssop in it. That's a really good antiviral. Homeopathics, love them. We have a lot of products out there. There's Cold Calm Kids, which is by Boiron, super easy to grab. It comes in these little kind of liquid vials, and you just have to give it pretty regularly. So if you are using a homeopathic, something you need to use regularly right at the onset of the cold. You don't want to try and do this, day 5. It's probably not going to be that efficacious. And also, it's not the best if you kind of do it like once and then 3 days later again, probably not that efficacious. There's a lot of controversy about homeopathics in the conventional medical world. So just so that you guys know, that is a thing. And what I can say about that is that it's hard to research. And at this point, what is happening with that is that we know that homeopathics are safe, and we're not quite sure how effective they are, but you can certainly try them. And there's lots of things that come in these for colds, like pulsatilla, apis, kali, nux vomica, a lot of things that the homeopaths feel are really helpful for congestion, fever, nausea, all of those things. So maybe something you want to try. Now, if you are giving pellets to a kid, you do need to be cautious again about choking hazards. So I do recommend, if it's a kid that's, 6 or under, go ahead and dissolve them in water. And you don't need to dissolve the whole pellet. The homeopathic medicine is on the outside of the pellet. So just let that kind of dissolve into the water. You don't need to wait like 10 or 15 minutes for the whole pellet to dissolve. And then just give small doses of that regularly to your child, okay? Hydration. So we do need to stay hydrated. So lots of water, herbal teas, broths, lemon, honey, ginger tea. These are great for soothing the throat. And honey in particular, like I said, is great for cough as well. The only thing with broths, you guys, is young children under 12 months, we don't want to replace their nutrition. So we're not using a broth to replace their breast milk or to replace their formula. And you don't want to use a lot of salt and vinegar in a broth because their kidneys can't digest the salt very well. So if you're making broth, just water and, like if you're doing like a bone broth, just the bones, and then just, as a supplement, okay, for hydration. And depending on your child's age, you're going to want to talk about like what's appropriate, what kind of amounts, and if they're having any other symptoms like diarrhea, vomiting, how much to give and all of that. So young infants, talk to your pediatrician. Older kids, teas and broths that are herbal teas, don't try and do caffeinated because it's a diuretic and then your kiddo can pee more than you think, and then they're, it's actually going the other way. Although I do see teens do that a lot. So, because teens tend to push themselves to do like sports and do academics while they're still sick, and then they're, downing the Monster, downing the the coffee, and they're trying to keep themselves alert, and then they're getting dehydrated because the caffeine's a diuretic, and then they're peeing out all their water. So keep an eye on the older kiddos with that one. Electrolyte drinks, just a little tip on those. There's plenty of them out there. Some of them have a lot of yuckies in them, like preservatives and food dyes. So just be cautious that if you are purchasing an electrolyte drink, make sure that you are getting one that's free of that, or just make one at home. And there's plenty of recipes online for those. Hopefully it goes without saying, alcohol. Teens, please don't drink alcohol in the first place. And second of all, if you are sick, it is not a good idea. Parents too, by the way. All right, I do want to say something about saltwater gargles. It's very challenging to get younger children to do these, but if you can get a younger child to do them, they are really helpful, especially with soothing the throat. You're just putting salt in water and having them gargle. Obviously, they have to have the motor skills to be able to do that. So, all right, immune boosting tips. So, sleep. Sleep is very critical for a strong immune system, and we do want to just kind of absorb that into our bodies a little bit and into our minds, because I do think in this society, the tendency is like, oh, it's just a cold. I don't need to rest. I'm going to, go to work on 5 hours sleep and I'm going to be fine. No, we really do need sleep to help. So for those kiddos who are sick with colds, definitely stick to a consistent sleep schedule. For age specific recommendations, school age kids, it's about 9 to 12 hours, teens, 8 to 10 hours, adults 7+. But again, when you're ill, you may need more than that. They may need more than that. So make sure that they're taking naps, that they're, having a good amount of time to rest. Try not to push them to go back to school too soon. I know sometimes it's not always possible with work schedules and all of that, but just try your best to make sure they're having enough time to rest. If they're having trouble sleeping, depending on the age of your child, so just make sure you talk to your pediatrician, your holistic pediatrician about doses and all of that. But some of the natural sleep aids, like a melatonin in the short term, can be helpful, or valerian root. But valerian can take a little longer to work. The taste is kind of yucky. So you might have to, if you're doing like a valerian tea, add honey or something to that. Other teas that are helpful, chamomile, passion flower. And then amino acids that are really nice for this would be like something like theanine or a tryptophan. But again, you just need to discuss those doses with your holistic pediatrician to make sure that they are okay and that your child doesn't have some contraindication or some reason that they shouldn't be doing those. Okay. Nutrition. Okay. I know that when kiddos are sick, it is so easy to give them anything. Like, please just eat something. And there are certain situations, especially with hydration, where it's like, you know what? The only thing that they're going to drink is Sprite. And we all know, not the best food in general, but we want them to drink something rather than nothing, right? Okay, that's sort of unavoidable. Now, if you do have a situation where you can get something else into your kid, please do, because, you know, the nutrient rich foods is what boosts your immune system. So, you know, it's kind of like your grandma always said, like, you are what you eat. It's actually true. So whatever you're digesting in your body, that is what everything in your body's made out of. So your immune cells are made out of whatever you're eating. Your brain cells are made out of whatever you're eating. Blood cells are made out of whatever you're eating. So everything's made out of what you're eating. And so if you're eating something that's nutrient poor, then sometimes the cells in your body can actually be not as efficacious or not as good at doing what they're supposed to do. So we do want to try to boost those. And things that can be really helpful would be like a vitamin C rich food like citrus or bell pepper or leafy greens. You know, oranges, strawberries, pineapples, any of those are great. Veggies like broccoli, tomato. If you need to, you know, it can be helpful to mix those kinds of things into like a smoothie or something a little bit more tasty, especially when kiddos are a little bit sick. Vitamin C supplements, just a little caution on those. If you do take, some people are sensitive to vitamin C, and also in general, most everyone, if you overdo vitamin C, it can cause like kind of issues with digestion, where you might get like upset tummy or diarrhea, things like that. So try not to go too overboard on the vitamin C. If you supplements, if you are using them, you're doing it to bowel tolerance, meaning as soon as you start getting bowel issues, you're going to back off that dose. And then of course you need to know what dose to use. So again, reach out to your holistic pediatrician about that. So we talked a little bit about zinc. I'll just touch on that again. The foods that are helpful: oysters, beef, pumpkin seeds, hemp seeds, cashews, chickpeas, mushrooms, legumes. Okay. So any of those are helpful. And I do like those a little better than the supplements, just because of those things that we talked about earlier, where, you know, you might displace the copper if you're doing too much zinc supplement. Plus the lozenges can be difficult for young children to take and all of that. So try to get those kinds of foods into your kid along with that hydration. Lifestyle wise, another thing we can do is humidifiers, vaporizers, those things. So those are really nice, just to humidify the air, keep everything moist, thin the secretions out, help people feel like they can breathe better and get all the goop out. You can add like 1 or 2 drops of essential oils for kids over 12 months old. If the kiddo that you're treating is 12 months or under, it can be a little much to vaporize these oils, because sometimes it can cause a little spasm in their throat, and that's not super safe. So we just want to, if you're doing essential oil in a young child, go ahead and mix 1 or 2 drops of like a lavender or peppermint, but just maybe even 1 drop, because that can be pretty strong. You know, something kind of a little bit more calm, into 2 ounces of carrier oil. So 2 ounces of, you know, coconut or avocado oil. So just 1 or 2 drops, don't go crazy. And then do like a massage. Okay. And that's to, you know, replace all of that like Vicks Vapo Rub and stuff like that, which isn't the most holistic. Stress reduction. I want to talk a little bit about stress, because in general, stress is one of those things that wreaks havoc on the body a lot of the time. I'm going to take a minute and do a little bit of sciencey stuff, because I think this is an important concept and something that's going to come into like the functional medicine discussions that we talk about later. But stress in the short term isn't necessarily a big bad problem. So if you are in the wilderness and a rock slide comes down and you need to run away from that rock slide so that you don't get crushed or something awful like that, then your body's going to go into what's called fight or flight. And that will release stress hormones like cortisol and adrenaline. And that's a good thing, right? Because you need adrenaline to run away. Okay. So your body's going to kick into like, we got to go, we got to get away from this rock slide. And it's helpful in these short bursts because, then you can do what you need to do. But if you're having long-term chronic inflammation in your body just hanging out, most or all of the time, that's a major negative. And that's a major negative because what happens is that starts to affect the immune system. So, and why is that? It's because cortisol, which is this like primary stress hormone, suppresses certain parts of the immune system. That in the short term, if you need to conserve energy for immediate survival is fine, but in the long term, it's going to, cause you to not be able to fight off infections very effectively. So we really, really want to work on our stress in general, and certainly while we're ill, so that we can disrupt this kind of cycle of chronic inflammation where our immune system is suppressed. All right, so what can we do about this? So I think this is just really important. We don't often think about this with young children, and I wish that we did more. I think it's so important. So practices that calm the mind, like meditation, yoga, deep breathing, listening to music, this will actually activate your rest and digest response. So this is known as your parasympathetic nervous system. And what happens is when we do those activities, we just counteract the fight or flight, and we lower our cortisol levels, we reduce our heart rate, we promote relaxation. And what happens? Our body says, oh my goodness, we don't have to conserve energy to run away from a landslide anymore. We can put our energy into digesting food well, into making really good immune cells, into building things, right? So that's what's happening with stress. There's a lot of things that we can do with children that you might not think about, or you may have thought about, but just, a good reminder. So one thing in this society, I think it's just, there's just a lot of pressure for kids to just hurry back to school. And I know you guys, that is not always possible to keep them home, depending on work schedules and with, just a lot of things, tests and stuff like that people, kids are worried about, missing and things like that. But if possible, if those kiddos can stay home when they are sick with colds, first of all, their immune systems are going to kick in faster and they're going to recover a lot quicker. And then they'll be able to be more productive later on. And also, it's just kind of nice because then it helps reduce spread to other people as well. And stress relieving activities. Yoga and walking. So obviously we're not going to be doing a ton of yoga and walking, especially not, those like vinyasa style hatha power yoga classes when we're ill. But, if you're in more of a recovery phase and you can do some gentle like yin, just relaxation techniques, things like that, that's really helpful. Cosmic Kids Yoga on YouTube is amazing for that. We can link that in the show notes. Walking, like maybe you have a sunnier day and you're able to just, take a few paces outside and get some vitamin D. That can be really helpful too. And you guys, these are things like, we also want to incorporate throughout life, right? Not just when someone is ill or having an emergency. Meditation, a lot of people don't think about this for kids, but there are some really good resources. So Sitting Like a Frog, mindfulness exercises for kids by, I'm going to say her name wrong, I'm so sorry, Aline Snell. Is a really nice book about meditation for kiddos. There's plenty of stuff online too. And then, like I said before, Mary Poppins Cosmic Kids Yoga on YouTube is great as well. If your kiddo is really not feeling well, the simple techniques like just taking a nice relaxing bath. For older kids, you could put a drop of chamomile or lavender essential oil, maybe even eucalyptus for, teenagers, people that can handle those stronger smells without sensitive skin, or just soothing music. So just listening to something like on Calm or Headspace, or just simply turning on, something on YouTube, or just, Pandora, whatever. Doing all of those things that are relaxing can really boost the immune system and create this connection between calm mind, which in turn reduces inflammation. So I think I've said this before, but a lot of times it's really interesting. We think of like our body as separate from our mind, but they're connected. Okay, we have this this neck here. If you're seeing me on YouTube, we have a neck, and the head is attached to the body via the neck. And there's a lot of things that go through there, the spinal cord and nerves and blood cells. So everything's connected. So what's going on in the mind affects the body. What's going in the body affects the mind. Okay, so they're not separate concepts. And I think that's really important in integrative and functional medicine to talk about a lot more. When to seek medical attention. All right, if your kiddo, God forbid, is having trouble breathing, please call 911 or go to the ER. What are signs of trouble breathing? Gasping for air, God forbid, turning blue, retractions, so sucking in, movements where they're sucking in above their, kind of in the neck area, above their sternum or below their ribs. If you see sucking in there, those are signs of trouble breathing. Later signs are to be head bobbing or grunting. That's a very late sign. Please call 911 if you are seeing that. Any concern with breathing, seek immediate attention. Okay. Prolonged illness, if I can spit that out. If your kiddo's not starting to kind of come out of it, by day 5, certainly by day 14, or they seem to be getting worse, like all of a sudden, maybe they had a little bit of a low-grade fever in the first 3 days, and then it went away, and then, a week later it's back. That's something new or worse, and you want to seek care and make sure there's not like a secondary infection. So see your pediatrician about that. High fevers, we talked about this in another episode, so we can link that as well. 108, that's where there can be issues with the brain. But if you are seeing a high fever, just in general, you're going to want to make an appointment with your pediatrician just to see what's going on. So if you have like 102 to 104, maybe just to make sure there's not some other secondary infection or ear infection, or maybe we have flu or COVID and it's not just a cold, those types of things can be a time that you want to seek more care. In conclusion, we just want to make sure that you guys know colds in general, most of the time we can just do natural remedies, decrease stress, get rest, eat nutritious foods, stay home, take care of ourselves, and things will get better. But, sometimes medical intervention is necessary and you just want to see someone for either reassurance or something else is going on, or it doesn't seem like it's quite lining up with like what you would think of as like a typical cold. So if you see any of that, definitely go ahead and seek care as well. So I hope that was helpful. Natural remedies on colds, all about colds, so much about colds. If you guys have any questions about colds, please let me know. If you're living in or around Asheville, North Carolina, and you need a holistic pediatrician 0 to 21, please go ahead and book that complimentary meet and greet. You can go to my website, middlepathintegrativepediatrics.com, and book it right there. Let's see if we can help you. Also, if you have functional medicine concerns, so for kiddos 2 years old to 102 years old, if you're experiencing long COVID, adrenal fatigue, burnout, stress, you want to optimize your health, your vitality, your longevity, so you can be around for your kiddos longer. You need help normalizing your cycles and getting healthy before you get pregnant. Any of that good stuff, gut issues that aren't being resolved, take a look at my website. I have all of the services listed for adults as well. But if you need functional medicine, definitely book a meet and greet for that too. All right. Well, I'm wishing you guys well, and I hope that was helpful. Please share this with anyone that you think that this information could help. Subscribe, all of that good stuff, and I thank you so much for listening, and I'm wishing you well. Bye.